Why is warfarin still widely used despite newer anticoagulants? How does it precisely prevent blood clots? What are the challenges of managing warfarin therapy? In this video, you will understand how it plays a critical role in preventing thromboembolic events, although its use requires careful monitoring and patient education. Warfarin is primarily indicated for the primary and secondary prevention of stroke, acute coronary syndrome, and venous thromboembolism. It is also used to prevent thromboembolism in patients with prosthetic heart valves. Its mechanism of action involves inhibiting the enzyme vitamin K epoxide reductase, which decreases the conversion of inactive vitamin K to its active form. This leads to reduced production of functional clotting factors 2, 7, 9, and 10, as well as proteins C and S, making it harder for the body to form blood clots. However, warfarin therapy comes with challenges due to its narrow therapeutic index. Patients require close monitoring of their international normalized ratio to ensure efficacy and minimize bleeding risks. The typical target INR is 2 to 3 for most indications, but may be slightly higher for patients with mechanical aortic valves. Warfarin also has a delayed onset of action, taking 2 to 3 days to reach full effect, requiring bridging therapy in certain cases. Adverse effects of warfarin include a high risk of bleeding, nephropathy, vascular calcification, skin necrosis, purple toe syndrome, and abdominal pain. Patient education is essential, as they must be aware of signs of bleeding, such as unusual bruising, black stools, or prolonged bleeding from cuts. Warfarin use requires caution in specific situations. It is contraindicated in pregnancy due to teratogenic effects and should be used cautiously in patients with alcoholism or fluctuating dietary vitamin K intake, as these factors can significantly alter INR. Furthermore, warfarin interacts with CYP2C9 inhibitors and inducers, as well as various medications, necessitating close monitoring when adding or discontinuing drugs. In summary, warfarin remains a vital anticoagulant for many patients, particularly those with mechanical heart valves or other specific conditions. However, its use requires diligent monitoring, patient education on bleeding risks, and careful management of drug and dietary interactions to ensure safe and effective therapy.